Okay, so we talked about some of the most common disorders. So now we'll talk a little bit about different therapy and treatment approaches to treat some of these disorders. Like I said, it might have made some more sense to kind of put some of these, interspersed in what I was just talking about. But also some of it is a little bit repetitive if I do it that way, because a lot of disorders have kind of similar treatment approaches in terms of, basically using some kind of therapy. So there's some benefits to separating it. So first we're going to talk just very briefly about the history of treating psychological disorders, which kind of the main takeaway from that is that a lot of the approaches we took in the past were very cruel and ineffective because people historically didn't recognize, what these psychological disorders actually were. They often had these false beliefs that psychological disorders were like demonic possession or witchcraft or, things like that. And so they tended to treat them in very cruel ways. Modern treatments tend to basically use some combination of therapy and medication. And so we'll talk about a couple different broad approaches to therapy, because it's not like there's just one kind of therapy. There's lots of different kinds. And then we'll talk in a little more detail about some of the medications that are commonly used for certain disorders. And then, I already kind of mentioned this before, but just keep in mind, most of these psychological disorders are very complex. They're very difficult to treat, and they may require some sort of lifelong management. They often require sort of multiple rounds of testing out different medications, different dosages, different kinds of therapies to try to figure out what's going to work for each individual person. So it can be a really complicated kind of process. So first, the history of mental health treatment. So like I said, historically, mental illness was often seen as having some kind of supernatural cause. Like I said, things like demonic possession, etc., were often what was, described as the core cause of these. And so to start, very early on in human history, a lot of these disorders were treated kind of as like possession. So they would have been treated with, religious means, things like exorcisms, to try to treat some of these psychological disorders. Execution and imprisonment were also common. So people who had the more severe disorders might have just been sort of put away in prisons, forgotten about, or at the extreme end, sentenced to death. Around the 1700s, we started developing asylums that were specifically for people with psychological disorders. And asylums were basically like prisons. They function very similarly, where each person has their own little tiny room that they live in, and their entire routine and day is like strictly scheduled and controlled. They might have been medicated very heavily with, different kinds of sedatives, basically, things to just kind of calm them down, put them in, to where they were almost asleep most of the time, just to try to control their behavior. But for the most part, they were just kind of like ostracized from society and locked away in these different treatment centers. Some other really cruel methods that were often used were things like skull drilling. So at some point, people kind of started to piece together that, these disorders are caused by something happening in the brain, or at least in the head. And they took these very rudimentary approaches to, well, then let's just drill a hole in the skull and hope that that fixes the issue. Oftentimes they would do like lobotomies, where they're basically drilling a hole into the front of the brain, into the frontal lobe. And it would work in the sense that it would stop the person's behavior, right? Like, let's say you had someone who now in modern times we would recognize maybe has autism or schizophrenia or something like that. Drilling a hole through the frontal lobes is basically going to sedate them. It's going to severely dampen their personality and their behavior to where they're basically going to be kind of like zombies, like just walk around. They'll still be able to maybe feed themselves, but they won't really have much function. So that's going to stop, whatever behavior you're trying to stop, but it's also like not really a person anymore at that point. Shock treatments were also very common. I will say we do still today do what's called electrical shock therapy or electroshock therapy. But modern electroshock therapy, we use very low voltages that are not necessarily even painful. They're definitely not lethal. And they're done in a much more controlled setting where maybe the person's under anesthesia. These kinds of shock treatments were more like kind of putting someone in like the, an electrocution chair or whatever. and putting large amounts of voltage through their body that could potentially be lethal and that was very uncontrolled. And then, like I said, just ostracization, putting them in asylums, locking them away from society. So those treatments were used really, a lot of them, especially asylums, were used up until about the 1950s or 1960s. There actually probably are still asylums open somewhere in the U.S. But around the 1950s and 60s, we started to understand a lot more about how the brain works, about the biological mechanisms that cause these psychological disorders. We developed the DSM, started to figure out how to classify and treat these different disorders. And so everything started to really turn in, I would say, a more positive direction around the 1950s and 1960s. So some of the modern approaches that we use to treat psychological disorders. First, like I said, there are several different kinds of therapy. One of the most common types of therapy is called psychodynamic therapy. And psychodynamic therapy is the one that Freud basically started. So we talked about Freud, I think, last time we had lecture. This is all based on his ideas about the subconscious, the id, the ego, the superego, those various stages of development throughout childhood. So really the main focus of psychodynamic therapy is trying to uncover stress and trauma that happened in childhood and how that now is impacting the person's daily functioning in adulthood. And this is mainly done through various kinds of talking, sort of probing the patient or the subject to talk about their childhood in various ways. So the idea is, let's say you have someone come into the therapist's office and they are suffering from symptoms of depression, and maybe you go through the DSM, you ask them questions about those symptoms, you decide that they should be diagnosed with major depressive disorder. Then you might start to talk about things that happened in their childhood that have led to, the way that they are now. So maybe you uncover that in their childhood, maybe they didn't have the greatest relationship with their parents, or maybe they were bullied as a kid, or whatever it might be. Then you can start to kind of pick apart those root causes in childhood through basically talk therapy. Some of the techniques that are often used, things like dream analysis. So Freud was a huge believer in this idea that we have all these unconscious things, right? All these unconscious things that developed in childhood. We might not have conscious access or awareness to them, but Freud believed that a lot of that unconscious stuff comes out in our dreams. And so in our dreams, we might have a dream about being bullied as a kid or whatever, and that might then bring up some of this stuff from childhood that then can be talked about in a therapist setting. So those who use psychodynamic therapy will encourage their patients to keep a dream journal and then bring that dream journal into the therapy sessions and kind of talk through those dreams and what they mean. They also use things like free association, which is where I would say a word and then you say whatever word first comes to your mind. So again, that's kind of looking at what are the unconscious associations you're making between various things. Another kind of form is what's called transference. So Freud believed that patients in a therapist's office will eventually come to view the therapist as some kind of role. Maybe they view them as a father figure, or maybe they view the therapist as a boss or whatever. And they will transfer their emotions onto the therapist based on that dynamic. So if the patient had a poor relationship with their parents, and then they come to view the therapist as kind of a father figure, then they might unload some of those emotions and things onto the therapist as if the therapist is their father. And Freud called that transference. For children who are undergoing therapy, you might also incorporate some sort of play. So having children use toys or dolls to act out various scenarios, having them draw in order to get at some of those same ideas in a way that's maybe a little bit more accessible to children. Kind of again, main thing to take away from this psychodynamic therapy is all about digging into childhood, finding those early traumas, and then figuring out how they connect to the issues that the adult is now facing when they come into the therapist's office. Another approach to therapy that's commonly used is called cognitive behavioral therapy. And cognitive behavioral therapy, shares maybe some overlap a little bit. So cognitive behavioral therapists might ask about childhood and, you know, kind of try to uncover some of those traumas. But it's a lot more about focusing on where you are now and trying to kind of pick apart like maladaptive thought patterns. So often people who have any of the psychological disorders we talked about, they often have thought patterns that kind of enable those disorders. So someone with major depressive disorder, for example, you know, if they wake up in the morning and they're trying to decide if they should get out of bed and get dressed and go to class, they might have a thought pattern that's like, you know, what's the point of even going? I'm not going to do good in class, and, you know, I'm just going to be a failure for the rest of my life, right? They might have this very negative thought pattern that they get into to where now they don't have the motivation to get out of bed and go to class, right? So cognitive behavioral therapy is all about trying to unravel and identify those unhealthy thought patterns and replace them with something that's healthier and more positive. So, you know, you might sort of, as the therapist, ask the patient about those thought patterns and help them, again, maybe journal to try to figure out when those thought patterns are coming up, and then replace them with something more positive. So instead of thinking what I just, you know, described, the therapist might say, okay, you should try to think in the morning that, you know, this is a new day. You can, you know, start a new routine now. You can break out of these bad habits you've been following. You can go to class and be successful and study. And, you know, you're going to be much happier if you get up and you do that. So trying to replace those negative, unhealthy thought patterns with something that's more positive. I apologize, I realize as I'm looking at this up here on this projector that that's kind of hard to read. That font is maybe not the best for a PowerPoint slide. Cognitive behavioral therapy also uses some of the principles we talked about from behaviorism. So things like conditioning and modeling, for example. So counter conditioning and exposure therapy. This is particularly useful for things like the anxiety disorders and post-traumatic stress disorders. So you can imagine, for example, if someone has a phobia of spiders and they want to overcome that phobia, they want to get to where they're more comfortable, then you can do what's called counter conditioning or exposure, where maybe, you know, on day one, you bring in the patient and you just try to get them to look at like a picture of a spider. And maybe even make it, you know, like a cartoon drawing of like a really cute looking spider or something like that. And just have them like, you know, how long can you look at this picture of the spider? And let's talk through what you're feeling as you do that. Like, is your heart rate going up? Are you sweating? Are you having, you know, fear or whatever? Let's talk through that. And then you gradually escalate. So this is what exposure therapy is. So if you get to where they're comfortable looking at that cartoon picture, like, okay, now let me show you a real picture of a black widow or something that's really scary looking, right? Okay, now you can handle looking at the picture. Let's bring in an actual spider. Let's put it in a cage on the opposite side of the room, very far away from you. Are you comfortable there, right? And then you're just slowly escalating over time, talking through, making sure the patient feels safe and comfortable until eventually maybe they get to the point where they can hold the spider in their hand and be totally fine. That would be exposure therapy. So the idea is you're kind of conditioning them to make this association that this thing that you're scared of is actually safe and totally fine and not scary at all. I already talked about this, so changing internal thought patterns, and then also working on changing behaviors that kind of are triggered from those thought patterns. And again, conditioning is often used, so trying to maybe reward the patient for, you know, making healthy advances. Cognitive behavioral therapy also sometimes focuses on like adjusting the environment to ensure success. I think we kind of talked about this a little bit in the context of ADHD. So, you know, like if you know that you suffer from ADHD and you know you're easily distracted by video games, then whenever you go to sit down to do your classwork, maybe having like the video game console in a separate room. Maybe if you have video games on your computer, then maybe having like one user login for work and a separate user login for games, and, you know, arranging your desktop so that when you're working and there's no games distracting you. All those would be examples of like you're adjusting your environment to try to accommodate whatever the disorder is. So again, main thing, cognitive behavioral therapy is focusing on identifying unhealthy thought patterns, replacing those with something more positive, and then hopefully through all of that, adjusting the person's behavior to be more healthy and to reduce the symptoms of whatever disorder they're suffering from. I would say those are the two main therapy approaches, are psychodynamic and cognitive behavioral therapy. There are probably others, but they're maybe a little more obscure and not used quite as commonly. Regardless of which approach to therapy you're using, there's a few different modalities that also have to be considered in terms of how successful the treatment will be. So first, there's a difference between what's voluntary and involuntary. So typically, therapy is going to be much more effective if the patient coming in is doing it of their own free will. They have recognized that there's an issue and they want to change and improve. Then that's often going to be more successful compared to if someone is involuntarily forced to go to therapy, which happens in various cases. So sometimes you could be court-ordered to go to therapy for some reason. You may have family members that, coerce you into going to therapy. Maybe they give you an ulterior motive. You either go or I'm going to end this relationship. In those cases, you have someone who's going not of their own free will. They're less likely to be successful in that case. There's also differences between things like individual therapy versus group or couples and family therapy. And all of those can be effective just depending on the specific disorder, the specific person you're trying to treat, etc. So group therapy can be particularly effective for things like substance abuse disorder, for some of the trauma disorders. Having another person who's gone through that and being able to talk to that group and hear their perspective, hear what's worked for them, can be very helpful. Couples and family therapy is obviously going to be helpful if you're having relationship issues. Family therapy can often be important if the patient is a child. Then working with the parents and the siblings can help ensure the success of that therapy. And now, of course, we also have virtual therapy as an option. So you can do in-person therapy. You can also now do therapy through Zoom or even phone calls, or even have BetterHelp where you can text your therapist, things like that. There's quite a bit of research that shows that virtual therapy can be just as effective as in-person therapy, particularly if it's mimicking, you're doing it through Zoom or something where you have that face-to-face interaction. So that makes therapy much more accessible, affordable. You can have therapy in places where you couldn't before. One of the things I will say, our healthcare system in general is not great in this country, but particularly mental health. There are lots of pockets of places that have zero access to therapists, particularly if you look at really rural areas. They may not have a therapist servicing communities for hundreds of miles. So having the option for virtual therapy is really important because it helps get into some of those communities that don't have access. Okay, so in addition to therapy in terms of talk therapy, we also have biomedical approaches using different medications. So in general, all these medications I'm going to talk about, what they ultimately do is that they alter the functioning of some neurotransmitter system in the brain. So with some of those disorders we talked about, how with the mood disorders, we have disruptions in serotonin and norepinephrine. So medications are going to target those neurotransmitters in order to try to, adjust that dysfunction. And for most of the disorders we have medications for, that's really what they're doing, is targeting those neurotransmitter systems. These must be prescribed by a medical doctor, typically a psychiatrist. So I don't know how many of you are interested in actually going into psychology, pursuing therapy or something as a career. But in general, if you get a master's or a PhD in psychology, you can do therapy. You can do the psychodynamic or the cognitive behavioral therapy, but you will not be allowed to prescribe medications unless you go to med school. So only medical doctors are allowed to prescribe these. So a psychiatrist is someone who has a medical degree in psychology. So that's very different from just having a regular PhD in psychology. So I could not prescribe medications because I don't have a medical degree. Okay, I'm going to kind of go through the medications a little bit quickly, just because, for time's sake, and they can get a little bit repetitive. For exam purposes, I do have name brands of some of these medications listed. The only ones I would say you really need to remember are for depression and ADHD. Okay? which for ADHD is the stimulants. And even on your quiz that I gave you today, you can see that those are the ones I'll ask you about. What are some of the name brands for antidepressants, and what are some of the name brands for stimulants? So for the rest of them, I list them up here just because like maybe it's familiar to you and you've heard of it, and it'll help you remember something about it, but don't worry too much about the details for these medications, okay? The first class, though, of medications are antipsychotics. So these are typically used for someone who has like schizophrenia and is suffering those symptoms where they have a break in reality. That's what they have typically been used for. I talked about how with schizophrenia there seems to be overactivity of dopamine. So really what antipsychotics ultimately do is that they block dopamine. And those will help mostly with the positive symptoms of schizophrenia. So they will do things like reduce hallucinations and delusions. Unfortunately, though, they tend to make the negative symptoms worse in schizophrenia. So someone with schizophrenia who takes antipsychotics, they'll have less hallucinations and delusions, but they will have increased like flattened affect. They'll have increased risk of like depression and just kind of like overall flattened behavior, essentially. Got some of the brand names listed there. I'm not even going to read them off. You can read them on the PowerPoint slide, hopefully better than you can read them up here on the projector. A lot of these medications we'll talk about have side effects, and so you always have to be weighing like the pros and the cons. You know, if I give you this medication, yeah, maybe it's going to help with your depression, but then it's also going to make these other things worse. So you got to balance that and kind of decide. So some of the side effects of these are dyskinesia, so that's like motor function basically is affected. Things like restlessness, sexual dysfunction, weight gain, and constipation are all side effects of these antipsychotics. So again, you've got to kind of balance, yeah, this is going to help decrease your hallucinations and delusions, but it's also going to make your negative symptoms worse, and it's going to have all these side effects. So you got to kind of balance that. So those are the antipsychotics. Next are the antidepressants. And all of these are going to affect levels of serotonin, and some of them also will target norepinephrine as well. So remember I said people with major depressive disorder, they tend to have dysfunction in their serotonin activity, and norepinephrine tends to be low in people with depression. So antidepressants are used obviously for treating depression, but they're also sometimes used for treating anxiety as well. So they can help with some of the symptoms of the anxiety disorders we talked about. Some of the brand names, so these are ones that you should try to memorize, are Paxil, Prozac, Zoloft, Tofranil, and Elavil are some others. So on the exam, I think I asked you to list like 2 of those. So if you can just remember 2 antidepressants, you'll be good for exam purposes. Some of the side effects of the antidepressants are things like headaches, weight gain, drowsiness, reduced sex drive, dry mouth, and nausea. And particularly with antidepressants, getting the dosage right is extremely important. That's true with a lot of these medications. But with some antidepressants, if you get the dosage wrong, like if you're prescribing too much or too little of the medication, it can actually make the symptoms worse. So it can make the person feel more depressed. It can increase like thoughts of suicide, things like that. So monitoring dosage and getting that dosage right is extremely important. So that's antidepressants. So I said these help with depression and anxiety, but we also do have a class of medications that are called anti-anxiety medications that help just specifically with anxiety. And essentially what these anti-anxiety medications do is they depress the central nervous system overall. So someone with anxiety, like I said, they have overactive sympathetic nervous system. So if we can kind of tamp down the activity of that sympathetic nervous system and the central nervous system, then that will help decrease these symptoms of anxiety. So it's used to treat anxiety. It's also used for some of the trauma disorders, like acute stress disorder and post-traumatic stress disorder. Again, these are brand names you don't need to memorize, but I'll list them anyway. So things like Xanax and Valium you've probably heard of before. Some of the side effects, probably not surprisingly, if you're suppressing the central nervous system and the sympathetic nervous system, you might have drowsiness. Also things like dizziness and headaches. Fatigue and lightheadedness are all side effects of these medications. think we've got 2 more classes of medications, and then we'll be mostly done. Another class of medications are mood stabilizers. These are used mostly to treat bipolar disorder. And particularly they're helpful with like the manic episodes of bipolar disorder. So essentially what these do, they're kind of similar to the anti-anxiety medications in that they're like depressing the nervous system overall, so they reduce excitatory activity. One of the difficult things with these mood stabilizers is that they often can help treat the manic episodes, but they may make the depressive episodes worse. So bipolar disorder is one of the trickiest ones to treat because you have those manic episodes, those depressive episodes, which is basically the brain swinging back and forth between these opposite extremes. So if you try to treat the manic, you're going to make the depression worse. If you try to treat the depression, you're going to make the manic worse. So it's very difficult to find medications that can kind of like balance that out effectively. So it's very complex, and you may have to take multiple medications in order to truly effectively treat it. Again, some of the brand names there. Side effects are things like excessive thirst, irregular heartbeat, itching, swelling, nausea, and loss of appetite. Okay, and the final class of medications are stimulants. These are used mostly to treat ADHD. So they tend to increase activity in the prefrontal cortex because people with ADHD tend to have an underactive prefrontal cortex. Some of the brand names, these are ones you probably have heard of, so this maybe shouldn't be too hard to memorize, but are Adderall and Ritalin. Those are the 2 most common that are prescribed. Some of the side effects are things like decreased appetite, difficulty sleeping, stomach ache and headache as well. Okay, I know we went through those pretty quickly. Any questions about medications? Okay, last slide is specifically about treating addiction. I know we didn't talk about addiction as one of the disorders, but that is a disorder in the DSM. It's actually called substance abuse disorder. I didn't include it just because we talked about addiction in motivation, but I don't think we talked much about treating addiction. And I wanted to put a slide for this specifically just because it kind of helps lay out the process of how, treating a lot of disorders typically goes. So addiction is complicated for a lot of reasons. One, the first thing that you really need to do with someone who's suffering from addiction is to just get them detoxed off of whatever the substance is that they are addicted to. And oftentimes that can be a very dangerous and tricky process. So some drugs, particularly like alcohol, withdrawal from those drugs can actually be deadly in some cases. So someone who is a very chronic alcoholic who has drank, lots of alcohol for multiple years, if they try to just quit with, no supervision or anything, they could potentially die from the withdrawal symptoms of stopping drinking alcohol. That's also true for like heroin and some of the opiates as well. So you need to be very careful in detoxing someone to, as like a first step. So in treating addiction, usually medications are prescribed to treat some of those withdrawal symptoms. Then the next step is going to be some sort of long-term rehabilitation. Usually these can be like 30 or 90-day inpatient programs where the person is in a facility, they're being monitored to make sure that they're staying sober. While they're there, they're also usually receiving therapy. So that could be psychodynamic therapy, it could be cognitive behavioral therapy. They're usually going to do a combination of both individual and group therapy sessions during that rehabilitation period. Then once the person is released, ideally they should continue some sort of lifelong therapy even outside of the rehabilitation. That could include things like Alcoholics Anonymous or Narcotics Anonymous. They may also involve family therapy. There's things like Al-Anon, which brings in family members. And then we can also use medications as well to help treat addiction. So there are certain medications that can help counter condition. So going back to kind of some of the things we talked about with cognitive behavioral therapy. So for example, there's a drug that alcoholics can take that if you take that medication and then you drink while you're taking it, it'll trigger like a reaction where basically the person will get sick, they'll have headaches, they may vomit. And so what that does is it teaches the person that every time you drink alcohol, you're getting sick. So maybe you shouldn't drink alcohol anymore. It's kind of this like negative conditioning that helps break the cycle of addiction. So, it kind of demonstrates how addiction, like any other disorder, often involves combination of therapy, medication, that has to happen kind of over the lifespan in order to manage whatever the disorder is.